With Roe v. Wade in jeopardy, pregnant women could soon face pretty serious health risks. According to NBC News analysis, close to half of U.S. states are likely to ban or restrict abortions. Well, now medical experts are weighing in, saying that the change could have pretty lasting implications. Let's go ahead and bring in NBC News breaking health reporter Aria Bendix. Aria, first off, experts are worried about these abortion bans because they say they could cause a pretty significant increase in pregnancy deaths. What is driving that concern? What does that mean?
Yeah, that's right, Morgan. So we know that the U.S. already has the highest maternal mortality rate of any developed country, and that number is actually rising. So we're seeing about 700 deaths a year, around 60% of which are preventable. And we know that it is relatively safe to get an abortion in the U.S., but, compared to other high-income countries, riskier to give birth. So if we see the number of abortions decline and the number of pregnancies go up, just statistically, we know that maternal mortality could rise. And we also know some of the reasons for that people who were denied abortions, who do not intend to carry a pregnancy to term, might be more likely to delay prenatal care. And they also might already have some pre-existing health conditions that made them want to get an abortion in the first place, and a pregnancy could exacerbate that and potentially push it toward life-threatening territory.
And in your report, you sort of talk about how these risks will disproportionately affect poor women and women of color. Why is that?
Yeah, so we know that if this ruling does come to pass in some states, people will be forced to sort of cross state lines to get an abortion, and that takes time. That takes resources. We also know that most people seeking abortions are parents already, so it requires procuring access to childcare. And unfortunately, that means that most of the people who are able to get abortions will be of high-income backgrounds, and those who are low-income or people of color may have a more difficult time. And then we may see some people who sort of test the legal boundaries in terms of seeking out an abortion. And we also know that communities of color, immigrant communities, and LGBTQ folks are more likely to be surveilled and targeted if they do try to get access to abortion medication or abortion procedures outside the legal limits.
And finally, I do want to talk about sort of these long-term impacts. I mean, how can forcing pregnancies affect someone years, decades down the line?
Yeah, so it's not just about the immediate risk to a pregnant person. There was a study, a 5-year study that looked at about 1,000 women in the U.S., the long-term implications of them being denied access to an abortion. And that study found that these women were more likely to face financial hardship, short-term anxiety. They were having a harder time providing food and transportation for their families. So there's a lot of really long-term implications, and it's also intergenerational. Their children were more likely to live below the federal poverty line, and experts are concerned, of course, about the mental health impacts long-term of women who are denied abortions. We know that it's always a difficult decision mentally whether or not someone chooses to carry a pregnancy to term, but we're really concerned about sort of the psychological stress that this new Supreme Court ruling could have.
All right. NBC's Aria Bendix. Aria, thank you for unpacking all of that for us. We really appreciate it.
Thanks, Morgan.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.